Artificial intelligence has affected healthcare in more ways than we can imagine. And today I want to talk to you about how the healthcare industry has been impacted and how it can enable itself to be more productive and efficient with the use of AI. I always say that AI will never replace you, but however, somebody who is competent in AI has a potential to replace you. And the way it is affected is just not purely in the practice of medicine in terms of healthcare enabled with artificial intelligence, but also in our research and in our teaching. So, what is AI? Artificial intelligence is basically a machine thinking like a human in a simulated manner. Generative AI is a subsection of AI where it creates new data based on the data that set that it has and is based on statistical predictability of what it should follow next. And this is interaction between the user and the system. And generative AI, especially ChatGPT that we are familiar with, is generative pre-trained transformer. What it does is transforms your prompts or your questions to what is already existing in its database based on statistical predictability of what is to follow. So it kind of gives you a human-like conversation through which we can interrogate a database. So AI has impacted healthcare in more ways than one, and in the areas in which it affects healthcare is in management to increase efficiency and productivity, in predictive medicine, clinical decision support systems, and patient data and demographics being used for enhanced diagnosis and monitoring. The problem and challenges with AI has been the skills to understand data, the skills to interpret data, and the collection and the collation of data, the quality of data. These are challenges that needs to be met in terms of what kind of data that is there in the AI that is producing responses from which we are going to base our decisions. The other big area is in the governance of data. As with any other data, healthcare produces a significant amount of personalized data that needs a proper governance system, and various countries are putting out various programs to govern the data. The other thing is the ethical use of the artificial intelligence response that comes out from our query. And this is very important. And so ethical framework for the use of AI in healthcare are being worked out in various national and international frameworks. So in healthcare management, how can AI help? Operational efficiency is one of them. In the area of fraud detection, administrative decision making, patient engagement, workforce deployment, development and training, and performance monitoring and quality assurance. These are not a complete list. There are various ways, and one of the products that we have developed in with my co-workers at the Asia Pacific Unis is the use of AI for efficient and productivity in the administration of healthcare or in any domain. In terms of predictive medicine, that's where we probably will find a significant amount of impact of AI in early disease detection, in chronic disease management, because the amount of data that comes through that can be used to for us to mine the data to provide efficient decision making and predictive nature of the AI systems that is available. The other thing in terms of patient data and diagnostics, and we start with the collection of automated data analysis and interpretation. This is where AI will come in. If we have large sets of data, both longitudinal and cross-sectional data of our patients, we can then, using natural language, be able to interrogate and have a conversation with that data to get insights that will help us in our care of our patients. In clinical decision support systems, these are very easily used if we have our set of data that we can then put up into an AI-enabled chatbot, for example, that would be able to help the decision support system. We have created a AI-enabled chatbot for hand surgery to help junior doctors make decisions based on certain criteria using generative AI as an API. So this is very useful to provide 24/7 support. One of the big challenges, obviously, is the AI systems, the trust. The data must be trusted, the data must be unbiased, and these are difficult areas, some of which we have no control over. However, within each institution, we can work out a form of trust that can be built with an ethical framework, and there must be readiness of the actors involved to be accept the AI. AI is here to stay. AI can help us tremendously. Yes, there are dangers. As long as we understand them, put in the frameworks for regulation and evaluation of the outcome, and make sure that there is buy-in by everyone for it to be effective. Governance model for AI, there are various governance model. This is one of the governance model produced by Reddy, and I think it fits in well with the ethical framework. Ensuring fairness, transparency, trustworthiness, and accountability. The transparency is very important, that as long as we know what is the data based on, and where we got that data. And we wrote a chapter in a book with my colleague Dr. Tirimuti on guidelines for use of AI in healthcare. Now let's look at closer to us, EPIC and AI. These are the various types of how AI has been incorporated into our EPIC system. And I think this is going to be quite challenging, and we can make use of this. There is the abridged clinical documentation, the use of partnership with Microsoft. Emory has done quite a interesting take on how to use AI for the use in clinical setting, and I think these are exciting times ahead of us. Now, Epic has also used personalized chatbot and the use of to help with decision making, and these case studies are there for us to look at the way in which we can incorporate this into our own Epic system to enhance and enable clinicians and users on the use of our data. So, just to kind of summarize, we are all very familiar with ChatGPT. I think most people have had experience with it, either as cursory or as in a regular format. But there also is the Copilot from Microsoft. Now, ChatGPT is the reliable version is ChatGPT 4 is $20 a month, is something that you need to think about. Whereas Copilot is free, but its functionality is slightly different, but again, useful for you to try. So basically, generative AI is a prediction of what's coming next in a sentence. So it's very complicated based on large data text. It uses natural language for us to have a conversation with a set of data for us to get information that's useful for us. So one of the important aspects of doing and interacting with a generative AI is prompting. So here is ChatGPT 4, the latest version with various functionalities. It's very, very interesting. I won't go into details of this. We're running a workshop on the 25th of November. You could join us, or next year, February 14, NSG will be running a workshop of AI in healthcare. So Copilot is the latest entrance to the market. They have made a decision. This is from Microsoft. It's part of Bing Chat, and they've made a decision to allow this as a consumer product that is within your subscription from Microsoft Office 365. And it has got the temperature. This is called the temperature setting. How precise do you want it to be? And it's one is very what do we call that? Not precise, allowing it for creativity. So whereas 0 is where the temperature setting is such that it's very, very precise and gives you specific. So generally for our use, we will take a low temperature setting. So one of the important aspects, as I mentioned, is actually in the generation of prompts, because garbage in, garbage out. How do you question the uh, AI system? So this is called prompting. Prompt generation is crucial. So what is a prompt? Prompt is the type of question, the way you frame the question to get a response. So the quality of your response is directly proportional to the quality of your prompt. So once you do a prompt, you get a response, then you make sure the cycle is you then have to validate that prompt. Is it reliable? Is it true? Is it contextual? And this is the role of real intelligence meeting artificial intelligence. Then we may have to revise the prompt until we get an answer that is factual, that is truthful, and that is in alignment with evidence. So here are some examples of good and bad prompts. It's pretty self-explanatory. As long as you give it the appropriate prompts with the appropriate guide, you will get good response. And I think this is an art and a science. And as we practice it, because it's natural languaging, it doesn't require any coding. So the most important aspect of the use of generative AI is response validation. I cannot overemphasize this. So the first step is to make sure that the response that you get has got relevance checks. Is it relevant? Is it accurate? Is the content consistent with the current body of knowledge? Is the sensitivity, is the response that you have obtained culturally sensitive? And this is very important because of the biasness that is within the database. And then you must learn how to refine your prompts to get better outcomes from the responses. So response validation is crucial, and this cannot be overemphasized. So here's a checklist for healthcare prompt engineering. So promptology, as I call it, is the new science that is a new requirement that every learner should have. How to create, craft, and develop prompts to get appropriate answers to enable our clinical practice, our teaching practice, and our research. So content creation is the content and context of the prompt is very important. You must be specific, you must be clear, and it must be contextual. So you have to provide. So sometimes writing the prompt can take a fair bit of time, and I tend to use a Word document to write the prompt carefully and then put it in to get our appropriate response. Very important is please avoid personal identifiable information to be uploaded into the AI system. Remember, whatever you write goes into the cloud, and your neighbor and everybody else can see it. You must make sure that your prompts and your responses meets the Patient Data Protection Act, and the ethical frameworks are being met. You must always maintain the ethics that we are all familiar with. Now, validation and reliability. How do we validate and make sure that the response are reliable? Evidence is we have to go back to evidence based. So if you're researching something, make sure that there is evidence in the literature to support the response that has been provided. Get an expert review, and most of us are experts in our own subject domain, so therefore we have the ability to make sure that the response is valid. Now, some of the older, ChatGPT 4 stops at 2022, but now there is potential to enable it to search the current internet and get current knowledge. But you must be aware of that. Sometimes what I do is I validate with that of a PubMed research to make sure that it keeps in alignment with the current body of knowledge. The other thing is you must make sure is the usability of the response that you get from your AI. Is it simple? Is it relevant? And is it actionable? And so this is something that your real intelligence will come in to validate the outcome. So what are chatbots? Chatbots are basically personalized generative AI with uses an API to facilitate this. So it's got a tremendous use in healthcare, especially decision support systems, and this can be easily created by anyone with the current trend. And ChatGPT just came up with My GPTs, where you can create personalized chatbots. I've created one for consent taking in orthopedics. I've created one for hand surgery, and so there are quite a few out there. So its potential is for triage, is for mental health support, patient education, remote monitoring, and most important, clinical decision support systems. So this is the latest ChatGPT's ability for you to create your own ChatGPTs on your own subject area. And here is one for the use of learning design for health professionals. But remember that the database is very much Anglo-centric, meaning it's very much English. And so we had some problems with the chatbot we created for leprosy, and we had to then translate it to Malay because the end users were in Malaysia whose English command was not so good, and so we created a chatbot with in the Malay language. In healthcare and education, it's a tremendous role in personalized learning, content creation, student engagement, and it makes it very accessible for anyone, anywhere to learn. So this is something quite useful, and you'll be surprised at the ability here. I've put in a request for to teach a module on abdominal examination, and as an hypothetical case, and asked it to create a curriculum. That which is in red is my context. I'm giving it a context. This is the basis of prompting, and that which is underlined in yellow shows is my instruction, what I expect it to create, and it's a pretty good outcome I get there. So here is also for content creation where you could use AI to help you with video production. Again, this will go through detail in the workshops, and here is an example of testing and where we can use it as a rubrics and as a grader for assessment. And here again, the answer is in green, and I asked this is a student's answer, and I asked it to mark it, and it did it pretty well. In research, it's got tremendous use. We have one of the platforms that I use commonly is typeset.io. This will soon become SciSpace, and it will, based on your research question, it will summarize, it will collect and summarize all the papers, and then you can validate that. So it really helps. And here are some of the resources that I have that you may find that useful. Thank you very much, and goodbye.